So we've spoken a lot about assisted reproductive techniques, where somebody's not being able to conceive properly, so you have to like take the sperm, take the egg, do this fertilization outside, then implant into the mother. So in trying to do this, you might actually want to do some genetic testing so that you are like implanting the best embryo. Do you understand? So you might want to do genetic testing for several reasons, okay, which will be stating in this lecture. So pre-implantation genetic testing, okay, you're just trying to evaluate, okay, the genetic analysis. All right, is this embryo actually good to go? So it's just a powerful tool. It's used in vitro fertilization. In vitro fertilization, I successfully fertilize the egg and the sperm outside before I'm implanting into the mother. You understand? So you screen embryos for genetic abnormalities. Do you understand? You just want to pick the best baby for the mom. So it helps to improve pregnancy outcomes. It reduces the risks of inherited conditions. So for the type, we have the type A. We are screening for aneuploidy, that's abnormalities of chromosomes. Alright, type M is monogenic disorders like sickle cell anemia or cystic fibrosis. Then the SR is just structural chromosomal, okay, abnormalities. You understand? So why it is done? Of course, you want to reduce the risk of complications coming up later. You want to prevent the baby coming up with genetic diseases. All right, so you want to pick the best thing for the family to balance the family. You understand? So how it works, at the blastocyst stage, a few cells are biopsied. Now these cells are tested for genetic abnormalities, so only healthy embryos will now be picked, then implanted into the mother. Of course, you are helping stop a lot of crazy situations that would have come up later on in life, right? So that's just what the pre-implantation genetic testing as a concept entails.